existing healthcare structure, the existing public hospital structure, operate more efficiently because it's substantially more expensive for them. Substantially more expensive if they, in the end, have to honor the healthcare guarantee and send someone outside a public hospital to get service.
Right.
So there is a huge financial incentive to, in fact, make the system operate more efficiently, which is why, exactly why we put it the way we did it, for two reasons. One, it is absolutely wrong for individuals to have to wait as long as they now wait for essential medical services. And two, you had to, the only way you could get around that problem was by putting governments in a position where it became very much in their own self-interest, not just their political interest, but their financial self-interest, to deal with the problem, which is exactly why we structured it the way we did, and none of which has anything to do with private delivery.
The doctor from Harvard, he actually appeared in this program when he was here and appeared before your committee, Dr. Relman, Arnold Relman, very distinguished physician, educator, and analyst of the medical system, gave evidence before your committee.
Yeah, we quote him, in fact, in the report.
You quote him a couple of times, but you also dismiss his quotes right afterwards by going to two other things. And one of the things that you went to was a draft of a study done by Bruce Ferguson at the University of Guelph, refuting what Dr. Relman said about commercial operations, about not-for-profit private operations in the United States, not being able to provide anything near what we could provide here in a public system.
Let me tell you what I don't understand in all this discussion, right? What you seem to be proposing is that we should have done two things, as I understand it. One, we shouldn't have attempted to limit waiting lines, and that is such an outrageous proposition. It's totally
I'm not saying that. I'm just telling you what
yeah, okay. But be clear. I mean, McBane wants the waiting lines to continue to get longer. That's the first thing. The second thing that you, or at least that's the implication of what he says. The second thing is, it seems that what is wanted is that we should have changed, said the Canada Health Act's got to be changed, or provincial legislation's got to be changed, or something, to do something that has never, ever been true in healthcare in Canada, which is that there should be restrictions on who can own or operate healthcare institutions. But, you know, that's what's being asked, because let's be clear, we didn't change anything, okay? So I don't understand why that, out of 400 pages, why that is such a big issue, other than the fact that he can't debate the substance of the other proposals, a whole pile of which enormously help individual Canadians, including the care guarantee, including catastrophic drugs, including palliative care at home, including an element of home care, and on and on and on.
What you have, a lot of critics have said that what you're proposing in, and I can't even remember, well, you tell me what the terminology is for the amount of money that we would each be giving towards the healthcare premium, which everybody says, read tax. That it's just another tax, and that for people making over, what, $130,000 a year, it would be something like $1,400 a year. Do you think that that's, and I know you've said that if we love this system as much as we claim we do, it's about time we started paying for it. Do you think that that's the way to go? And if it is, why did you back off on what everybody thought you were going to do, which is that 3.5% or 3.5 cents of the GST going to this?
I'm not responsible for what people thought we were going to do. People thought we were going to do all kinds of things. There were all kinds of rumors. The media loves spreading rumors about things that they think are true, and then when they turn out not to be true, they say to me, why did you back off? Well, we didn't back off. We took the proposal we've got. I mean, that's absurd.
But why didn't you go that route, though? Wouldn't that have been a better route?
No, as we've explained, if you have to go through the report. We take the pros and cons of all of the options for revenue-raising money, and our conclusion was that given the nature of this as an insurance issue, that what you should do is have a fund set up like the CPP fund is set up. It's earmarked money. It's money that can be audited, that you know where the money goes, all of the same provisions that apply to the CPP, so that the healthcare system would be there when people needed it, in the same way that the Canada Pension Plan money is there when you need the pension plan money. And so we opted. It's a judgment call. Okay, look, people can argue other fundraising measures. I'll tell you, if we hadn't put in a fundraising measure, if we had simply said you need $5 billion, all the media and others would have gone nuts, saying, how can you propose $5 billion and not offer a method of raising the money? So now we raise the money, and they want to attack the method of raising the money. I mean, that's the advantage of being in your job rather than mine. In our view, frankly, it would be totally irresponsible to put out a health care plan and not document exactly how you believe government ought to raise the money if government needs to raise it. Now, if they've got the money in the surplus or if they've got it somewhere else, that's terrific. But you know, most governments don't have $5 billion sitting in their hip pockets. So we thought that to be responsible, and I assume anyone else dealing with the issue is going to do the same thing, but we thought that was a responsible thing to do.
Okay, last question then, because we're almost out of time. Did you delay this report by a year so that it would come out just before Romano's final report?
No, it's a good thing we're not allowed to use strong language on the air.
Well, you can if you want.
No,
Go ahead.
somebody ought to go back and read what happened. We started this issue long before Romano began, right? We were asked to do it at the time
by who?
The Deputy Minister of Health, David Dodge, when he was Deputy Minister of Health. He's now gone to the Bank of Canada. We laid out a timetable. The timetable called for us to finish in June of this year, right, over a 2.5-year period. Well, the committee was out of action for about 5 months because the committee ceased to exist when elections are called. So in a sense, we lost of the 2.5-year timetable that we originally laid out, which was to start in February of 2000 and carry through to finish in 2002. We lost it because the committee didn't exist through the fall and then January of 2000 when the election was. So the 5 months got added on to the end, which took us to where we are now. I mean, we have simply followed exactly, precisely the work plan and timetable that we set out to do. And I mean, I think it's a good thing. There's going to be a debate of ideas. Roy Romano's been a longtime friend of mine. He was very kind last week. He called me on Thursday before the report came out to wish me good luck in the launch and all that stuff. I've known him for 20 years. I mean, all this, it's as usual, people like to look for skeletons where they don't exist and to look for conflict where it doesn't exist. Roy and I have always been friends. We will always be friends. And all we've done is do what we said we were going to do.
All right, Senator. Thanks a lot for coming in.
Glad to be here.
All right.